This is case report number 7, case 1. This is a patient with sudden loss of vision. It was previously the best eye with vision of 1.0. Now we have a very large submacular hemorrhage. What would you do? Well, I decided to do a subretinal RTPA injection or Actiluse. I always do this in patients which have a hemorrhage which goes over the arcades. If the hemorrhage is within the arcade, I only inject gas and RTPA into the vitreous cavity, no vitrectomy. But in these very large hemorrhages, I do a subretinal RTPA injection. This is actually a different case compared to the case before. It is a smaller hemorrhage, but exactly the same technique. So the first step is, of course, core vitrectomy. This is the 41 gauge dual bore cannula from Dork, and the RTPA is attached to this cannula. There's also a 25 gauge cannula available today from Medilens. This one is 20 gauge actually. So I have to change the trocar cannulas, switch them. And please look before you pierce the retina that the medication and not a air bubble comes out of the syringe. Now you can pierce approximately at the arcade, eject the air bubbles. Now the medication comes. So now we can pierce the retina. These small holes don't need to be lasered. They're actually very too small. There's no laser coagulation necessary. I do it usually like this, that I hold this cannula and the scrub nurse injects the medication. You see now that how the edges grow and get faint. This is the medication. So you actually induce a inferior detachment. Please note at 6-7 o'clock how the bubble grows. And what happens is that the blood gets coagulated and moves down into the big inferior created detached retina away from the macula. So we're creating a big RTPA bubble, and the blood will liquefy and flow into this big bubble. Yes, and there's also a 25 gauge cannula available today. The next step is a fluid air exchange. And then I inject Avastin, and finally 20% SF6 tamponade. The patient has to lie on the back for 2 hours and then face down. Let's come to the 1 day post-op of the previous case. This is 1 day post-op. Please note the inferior detachment. You see it much better here. There's a very big inferior detachment, which is a subretinal blood which has been pushed downwards. This is 4 days post-op. See that there's almost nothing left of the blood. So this is pre-op, 1 day and 4 days post-op. And the final result in this case is 0.2 3 months later from hand movement. Case 2. This is a 17-year-old woman. VA 0.1. What is your diagnosis? Well, this is optic dispute, obviously. This is one more OCT. So I did surgery here, lens sparing vitrectomy with PVD and gas, no ILM peeling, and no laser barrier. This is a 3-month follow-up. The VA is 0.1 to 0.2. This is a 6-month follow-up. Visual acuity is 0.2 to 0.3. This is a 15-month follow-up. VA is 0.5. This is 2 years follow-up. The visual acuity is 0.2. In all cases with optic disc operated, the surgery was successful, but the patients did not experience a substantial visual acuity increase. Case 3. What is your diagnosis? Looking at the IOL in the iris, please note the transillumination. That's the question. Well, this is an iris depigmentation secondary to implantation of a one-piece IOL into the sulcus. So the haptic causes the depigmentation of the iris. Thank you very much.